Many people, if they come to a teaching program, will wonder, what is a resident, what is an intern, who are all these people that I have here? And I think the easy answer is to let you know how we become doctors. So we start out with 4 years of medical school. That prepares us then to decide what area of medicine we want to go into. Some will choose to do pediatrics, some family practice, some obstetrics, and things like that. You then spend 3 years in whatever area you choose, and for our residents it's pediatrics. And that's 3 years where they train under pediatricians and subspecialists in pediatrics to learn how to become a pediatrician, to get a full general peds training. The first year of that residency is called internship. So an intern is a first-year resident. The second and third year residents are either called second or third year residents, or they can be called senior residents. And so it's a 3-year program that gets you to the point that you can finally go out and become a general pediatrician if you choose to do that. Some people decide that they want to go further and they want to become a specialist in some areas of pediatrics. So if I wanted to become a specialist in cardiology, the heart for instance, I would then finish my 3 years of pediatrics, but then at that point go on and do an additional 3 years of training just in cardiology. So I then could become an expert in pediatric cardiology. We call those fellows who go on, those people who go on for extra training, fellows. And so you have first, second, and third year fellows. So if you ever have to go see a pediatric cardiologist, that person has at least done 6 years of training beyond medical school to get to the point that they're at. A lot of people wonder, what is it like coming to a teaching hospital? And I think number one, it comes across a little bit confusing because you don't just see one doctor. There are a lot of different people coming in. And depending on where you are in the hospital, you may have a medical student who helps with your care. You'll always, if you're admitted, have an intern as well as a senior resident. But I think what people need to realize is all of those people are being supervised by somebody who's an expert in the care that they're going to deliver to you. And so in reality, when you're at a teaching facility, you're actually receiving the best care that you can for whatever problem you're coming in for, because you're being treated by people who are expert in those fields. And those people are in charge of supervising and making sure that the residents are learning and providing good care for you. And what that means is that all of us who do that work as what we call attending physicians, we have to keep up in our field because the residents will ask us questions or have things, and we have to know our field well enough that we can actually teach it and mentor them along so that they can gain the skills. So I honestly feel that if you come to a teaching hospital, despite the fact that you're going to see a lot of different people and you just need to get the roles correct, you're going to find that your care is really outstanding and really at the really state of the art for whatever you're coming in for.